Okay, I think we'll go ahead and get started. So good afternoon, everyone, and welcome to part 6 of the 7-part ATSDR Public Health Assessment Training Series, which is organized by ATSDR's Office of Community Health and Hazard Assessment, or OCHA. I am Greg Eulersch, and I'm an environmental scientist within OCHA's Office of the Associate Director for Science, led by Dr. Jane Lee. I will be the moderator for today's webinar. Before we start, I have a couple of housekeeping notes. First, this webinar is recorded and the recording will be released to the public. As a matter of fact, 2 of the series, or actually 3 at this point, have already been posted to CDC's YouTube, and I will post a link to that channel in the chat box in a few moments. So all audiences are muted during the presentation. If you have questions, please type them in the chat box. At the end of the presentation, we will answer all questions received in the chat box. After that, if we have time, we will enable the live Q&A. Today's webinar is focused on ATSDR's new Exposure Point Concentration, or EPC tool. Specifically, we will provide a brief background on the tool and then provide you with a demonstration of how it works. Our main presenter is Dr. Will Morgan from our Eastern Research Group contractor, and he'll be assisting with answering questions and triaging, and I'll be answering and triaging questions. Also, I wanted to thank James Durant from OCHA for lending his statistical and other expertise to the development of this tool. And finally, Rebecca DeVries, Will Morgan, and others at ERG for being instrumental in getting this tool launched. Rebecca is part of the panel today and will be available at the end to help answer questions. Rebecca, would you like to introduce yourself?
Sure, thank you, Greg. My name is Rebecca DeVries, and I'm a health scientist at ERG. I've been working with ATSDR for several years now, specifically with Greg and James, providing contractor support on the development of this tool, as well as several of the guidance documents that the tool is based on. I look forward to the presentation, and as Greg mentioned, we'll be on the line at the end to help answer questions. Thanks, and back to you, Greg.
Yes, thank you, Rebecca. And so now let's turn it over to Will, and welcome, Will. Thank you.
And so good afternoon, everybody, and welcome to the webinar. As Greg mentioned, my name is Will Morgan, and I work for ERG, a contractor for ATSDR. Today, we'll be talking about ATSDR's Exposure Point Concentration tool, or the EPC tool for short. I'm going to start off today with some slides that outline what the program does, and then I'll give you a brief demonstration as to how it works. So to begin, let's start out with a description of what exactly the ATSDR EPC tool is. The EPC tool is an R-Shiny web-based application built to assist health assessors with estimating exposure point concentrations, or EPCs, for discrete environmental data. For each environmental data set loaded into the tool, the program will calculate an EPC that's either the 95th percentile upper confidence limit of the mean of the data, or the maximum value of the data for cases where 95 UCLs can't be calculated. ATSDR created the tool to make the process of calculating EPCs based on ATSDR guidance documents more consistent and efficient. The guidance documents addressed by the tool are ATSDR's Exposure Point Concentration Guidance for discrete sampling, ATSDR's guidance for calculating benzoate pyrene equivalents for cancer evaluations of polycyclic aromatic hydrocarbons, and ATSDR's toxic equivalence guidance for dioxin and dioxin-like compounds. The EPC tool automates procedures from these documents so that health assessors can quickly and accurately calculate EPCs for their data in an easy-to-use program. The tool also provides some useful supporting tables and figures with summary statistics and other information about the calculated EPCs. And it has a feature that allows health assessors to export the calculated EPCs and other data for additional analysis in ATSDR's Public Health Assessment Site tool, or FAST. So as I mentioned, the program automates steps from these 3 ATSDR guidance documents. The program's main algorithm for calculating EPCs comes from ATSDR's discrete sampling guidance. In that document, there's a step-by-step workflow that health assessors can follow for calculating EPCs as either a maximum value or a 95 UCL. The algorithm accounts for the number of samples analyzed for a contaminant, the frequency of contaminant detections, and for certain data sets, the distribution of the contaminant data. The algorithm returns the dataset's maximum detected value anytime the dataset has fewer than 8 records, fewer than 4 detections, more than 80% non-detects or only one unique detected value. If the data set has 8 or more records and doesn't meet any of the criteria for calculating a maximum, the algorithm tries to calculate a 95 UCL. For data sets with 8 to 19 records, the algorithm fits 3 different data models to the data and derives the 95 UCL from whichever distribution had the best fit. And for data sets with 20 or more observations, the algorithm calculates the 95 UCL using bootstrap sampling. The algorithm includes a lot of other details related to things like the number of detects and non-detects in the data, quality control checks, and so on. But for the sake of time, we won't get into those today. If you're interested, though, you can read through the guidance document for more information. There's a link to the guidance on ATSDR's website in the last bullet on this slide. And also, you can watch the archived discrete sampling guidance training from earlier in this webinar series, which should be posted on ATSDR's FAGM website at some point soon if it isn't there already. So in addition to the discrete sampling guidance, the program also includes special calculations for PAHs and dioxins. For both contaminants, these calculations relate the toxicity of a mixture of contaminants to that of a single reference compound that has similar toxicological properties to the other compounds in the mixture. For PAHs, the reference compound is benzoapyrene, or BAP for short. For cancer risk evaluations, health assessors can calculate a BAP equivalent concentration that accounts for the overall carcinogenicity of a mixture of PAHs. The process involves weighting the concentrations of PAH congeners in the mixture by their toxicity relative to BAP's toxicity and combining them all together to get an estimate of the overall toxicity of the mixture. To calculate the maximum BAP equivalent across a group of samples with PAHs, the EPC tool calculates BAP equivalents for each individual sample and then returns the highest BAP equivalent from any sample in the data set as the maximum value. For EPCs, the program first calculates an EPC for each PAH congener in the data set using the regular discrete sampling guidance algorithm that we just looked at. And then it weights those EPCs by their toxicity to BAP and sums them to get the EPC BAP equivalent for the data set. There's a lot more that goes into these calculations than what you see on this slide, but we're not going to get into that today. For more information, though, you can see the PAH guidance document, the link to which is shown here, or the recording of the PAH training webinar that occurred last week once it gets posted. Dioxins are similar to PAHs in that ATSDR's guidance specifies the calculation of a toxic equivalent concentration to evaluate mixtures of dioxins. In this case, the reference contaminant is 2378 tetrachlorodibenzo-P dioxin. For this webinar, I'm referring to the collection of dioxins and dioxin-like compounds discussed in ATSDR's guidance as just dioxins for simplicity. And I'll be referring to the 2378 TCDD-TEQ as just the dioxin TEQ. Unlike the BAP equivalents for PAHs, which are applicable just for cancer evaluations, the dioxin TEQs can be used in both non-cancer and cancer evaluations. To calculate a dioxin TEQ for a group of samples with results for dioxins, the EPC tool first generates a dioxin TEQ for each sample in the data set, and the maximum dioxin TEQ is just the highest TEQ among all the samples. For the EPC, the program uses the individual sample TEQs as inputs into the discrete sampling algorithm and uses the output of the algorithm as the EPC for the collection of samples. The process is a little different from the process specified for PAHs, but again, we're not going to dive into the details today. If you want to know more, though, you can look at ATSDR's guidance document for dioxins, and it'll walk you through the process for calculating dioxin TEQs. So before we move on to the program demo, I wanted to take a quick minute to mention a few things that the program doesn't do. So first off, the program isn't an exploratory data analysis tool. Some of the program's features may be helpful for exploratory data analysis, but the main point of the program is to calculate EPCs. The EPC tool also isn't a contaminant screening tool or a tool for evaluating hazard quotients or cancer risk. It doesn't store any health guidelines or contaminant information within the program, but it does allow you to export results that can be imported into FAST for further analysis. Also, the EPC tool doesn't save any site data that you upload, so you'll need to make external copies of any data sets that you're working on so you can reference them again in the future. In terms of the algorithms in the program, the EPC tool doesn't include steps from ATSDR's Exposure Point Concentration guidance for non-discrete sampling, since the instructions from that guidance document aren't easy to automate. The program also doesn't automate the steps from the discrete sampling guidance document for generating EPCs for acute exposures. The EPCs returned by the program will apply to intermediate and long-term exposures, and they may be useful for evaluating acute exposures, but you'll need to review the steps in the discrete sampling guidance to determine if they apply for acute exposures at your site. So that's everything I wanted to cover in the intro. I've added a link to the program here, which you can use to access it and try it out later on. Also, I've said a few times now that you can refer to the guidance documents for further information about the calculations in the EPC tool. You'll see this when we get into the program demo, but all the documents I mentioned are available for download from the EPC tool resources page, so they'll be readily available when you're using the program. The resources page also includes a user's guide for the EPC tool that you can reference if you have questions about using the program. You can also find other ATSDR guidance documents and resources related to the public health assessment process on the web-based Public Health Assessment Guidance Manual resources page, a link to which is shown here. If you have any questions about the EPC tool not covered in the user's guide or in any of the other documents from these sources, you can email fast@cdc.gov for assistance. For any emails that you send to the FAST address, please include the phrase ATSDR EPC tool in the subject line so that the FAST team knows that it's a question related to the EPC tool and not a question about something else related to FAST. That brings us to the end of the intro slides. Next, I'm going to minimize the presentation and pull up an internet browser, open the CDC Secure Access Management System portal so I can show you how to access and use the program. If you've never accessed the SAMS portal before, you'll need to send an email to fast@cdc.gov to request access to it. If you're an external user, you can access the portal by typing in your SAMS username and password. If you're a CDC or an ATSDR user, you can access the portal using your AMS login. I'm going to take you to a screen that shows you what it looks like for me after I log into SAMS. So depending on how your setup is configured, you may see something different from what I'm showing here when you log into the portal. For me, I have a link that reads SciComp SAMS portal, which I use to access the EPC tool. If you don't see a link that reads SciComp SAMS portal, contact fast@cdc.gov for assistance. The SciComp group is CDC's Scientific Computer and Bioinformatics Service Group, or just SciComp for short. I'll go ahead and click the link now to go to the SciComp application landing page. From here, you'll see any programs that you have access to that are supported by the SciComp group. You can access the ATSDR EPC tool by clicking the box that says EPC tool. For today's training, though, I'm going to bring up a local copy of the program that I already have open on my computer. So when you first open the program, it opens up to the EPC tools data import screen. The big blue box right here in the middle of the screen has a welcome message introducing the tool and gives brief instructions on how to use the program. At the top of the screen, you'll see 4 tabs, 3 on the left and 1 on the right. You can use these tabs to navigate through the program. The Data Import tab and the Resources tab are the only 2 that are active initially. The Results Summary and Results Details tabs start out grayed out, but they'll become active once we run some data through the program. Beneath the blue box, you'll find instructions about how to import data into the program, and beneath those, you'll see a Browse button that you'll use to load data. Before running any calculations, you'll need to input your site data into a copy of the program's data import template. The data import template is an Excel file you can access by clicking the Download Data Import Template link on the right side of the screen. Clicking on the link will download a clean copy of the template. I'm going to switch over to a copy of the template that already has data in it so you can see what a properly formatted data set looks like. The file that we're going to look at contains dummy data for contaminant records at a soil vapor intrusion site. It has example records for 13 contaminants in air, soil gas, and groundwater collected at locations within or near 6 buildings. You don't need to pay too much attention to the specifics of the data set, since the main point of what we're doing currently is just to look at the information required to run the program. However, I wanted to go ahead and give you an idea of what the data represent now, since we're going to run this data set through the EPC tool later on. The raw data tab of the template has 8 required fields that you'll need to fill with data. Every row in the data set represents a unique measurement of a contaminant, like what you'd receive in a lab report. You'll need to input data into all 8 fields of the template for every row where you add data. If you leave any field blank in a row with data, the program will throw an error when you try to load the template. Starting from the left, the first column in the template is the exposure unit field. An exposure unit is a geographic point or area where a person contacts an environmental medium, such as soil, surface water, or air. Examples of exposure units include a residence yard or playground, a well system that serves a neighborhood, or a private well serving a single home. In this file, the exposure units are defined as 6 different buildings. You can see here that the first one is named Building 1, farther down they're labeled Building 2, Building 3, and so on. ATSDR is a guidance document that gives more information on identifying exposure units, and there's a copy of it available on the resources page if you're interested. If you don't have an exposure unit for your data, you can enter a generic site name or other identifier in all the rows. The next 2 columns are the contaminant and chemical abstract service registry number, or CAS number fields. The CAS numbers and contaminant names have to match for all the records that you enter. For example, in this file, you can see that each row with bromobenzene listed as the contaminant has the same CAS number listed in each of the CAS number field cells. The program won't let you choose 2 different contaminant names for the same CAS number or 2 different CAS numbers for the same contaminant name. If you try to, the data won't import and you'll get an error message. The 4th field in the template is the media field. The template makes you pick from one of the 6 media that are available in FAST. Your options are water, soil or sediment, air, food, and then 2 options related to soil vapor intrusion, soil gas and groundwater. The next 2 columns after the media field are the concentration and the unit fields. Numeric concentration associated with each data record goes in the concentration field, and the concentration units go in the unit field. The concentration field will only accept numerical values. It won't accept any text flags, so if your data set contains things like MDL for method detection limit or ND for non-detect, you'll need to find the full value of the detection limit and input it into the concentration field instead. Also, even though the field is named concentration, you can enter mass or radiological data so long as you enter appropriate units into the unit field, which will accept whatever units you type into it. After the unit field, we have the detected flag field. This is a 0-1 field where you enter 2 if the record this is a 0-1 field where you enter 0 if the record represents a non-detect and a 1 if it represents a detect. The detected flag field only accepts 0 and 1s. So if you enter anything else into this column, you'll get an error message like the message that's about to appear when I try typing in the number 2. Pressing cancel clears the error message and resets the value in the field to whatever it was before. The final column in the template is the sample ID field. You can use this column to input the sample IDs associated with each record. For the groundwater records we're looking at currently, the sample ID represents the name of the monitoring well where the sample was collected and the month and year when it was collected. The sample ID field will accept any text you enter it, so you can enter in whatever sample names you have for the samples at your sites. You also have the option of adding additional columns to your data set, although there aren't any shown in this file. The program won't use any extra columns you add for the EPC calculations, but you can include them in the template for your own reference if you want to keep track of something specific while you're working on a site, or if you want to maintain additional information in your file that you might need to fully document your data set. For example, if you have specific contaminants, if you have specific comments on an individual sample in your data, you can create a notes field in the template to keep track of those. Keep in mind, though, that you have to have the 8 original columns in the template when you load your data into the program, and you can't rename them. If you delete any of the original fields or change their names, the program won't let you load the file, and it'll give you an error. If you have any questions about the information that belongs in these fields, you can click the README tab to bring up some additional information about each field and about filling out the template. The data entry field section has information about the data that belongs in each column. And the notes about the ATSDR EPC tool data import template section has additional information about how to fill out the template and additional information about some of the fields. Now let's go back to the EPC tool and import this data set so you can see how the program calculates EPCs. Back on the data import screen, our next step is to import the data we were just looking at into the EPC tool. Clicking the Browse button opens a window that you can use to navigate to your data set. I'll go ahead and navigate to the file we were just looking at and double click it to import it into the program. If the data loads successfully, you'll see the file name appear in the gray box next to the Browse button, and you'll see a table named Data Import Summary appear beneath them. If the data don't import successfully, you'll get a red box and an error message here instead. The Data Import Summary table gives you a few summary statistics about your data set and lets you know the number of EPCs that the program will attempt to calculate. The first column shows the total number of observations in the data set you imported. You can see here that our sample data set includes 433 contaminant records. The second column shows the number of unique exposure units in your data set. The third shows the number of unique contaminants, and the fourth shows the number of unique media. The data set we loaded contains data for 6 buildings, which we used as the exposure units for the analysis. In the third column, you can see that the data contained contaminant records for 13 contaminants, and in the fourth, you can see that the records come from 3 sample media. The fifth and final column shows the number of EPCs that the program will attempt to calculate. If you look here at this field, you'll see that the program is going to calculate 27 EPCs for this data set. So now you might be asking, where did it get 27 from? When you load your data set, the program reads the data and identifies all the unique combinations of exposure unit, contaminant, and medium in the data set. After identifying those combinations, it will attempt to calculate 1 EPC for every unique combinations of those 3 fields in your data. For example, in the Excel file we were just looking at, the first set of records were for bromobenzene and groundwater near building 1. The combination of bromobenzene for the contaminant, SBI groundwater for the medium, and building 1 for the exposure unit represents 1 unique combination of those 3 fields for which the program will calculate an EPC. We'll also calculate an EPC for the other 26 unique combinations of medium, contaminant, and exposure unit represented in the data. This seems a little confusing now. It may make a bit more sense once you see what the output results look like. So I'll go ahead and click the Calculate EPCs button here at the bottom of the screen to generate EPCs for the imported data. While the EPCs are calculating, you'll see a progress bar appear that shows about how far along the calculations have progressed. When it reaches the end, the progress bar will close and the program will jump to the results summary screen. Depending on the types of calculations that the program is performing, you'll sometimes see the progress bar stall for a few seconds before it moves again. Those stalls typically occur when the program is conducting bootstrap sampling for datasets with 20 or more records. We'll give it a little more time to finish all the calculations and jump to the results summary screen so we can see the results. Here we go. Okay, so the results summary screen has a table that shows the overall results of the EPC calculations. At the top, you'll find some basic instructions about how to use the table and export results, and beneath those, you'll find the table itself. The Show Entries drop-down here on the upper left side of the screen lets you specify the number of EPCs that appear in the table at the same time. The table includes 1 row for each EPC, and you have the option of showing up to 100 results at once. In our data set, we had 27 EPCs, so if we wanted to see all 27 at once, we could select the entry for 50 from the drop-down menu. For now, though, I'll click out of this menu and stick with the 10 EPCs we have shown currently. The first 3 columns in the results summary table identify the exposure unit, medium, and contaminant combination associated with each EPC. You can see here in the 10 results that we have visible that there were 8 contaminants represented in the groundwater samples for building 1, and at least 2 contaminants in air samples for that building. The first record shown is the one for bromobenzene in groundwater at building 1 that we talked about earlier. Each one of these rows represents a unique combination of exposure unit, medium, and contaminant from the original data set, so each one has an EPC result in this table. The next column identifies the units for the EPC calculation, and the 2 columns after the units column identify the EPC value and the EPC type. If the program was able to evaluate an EPC, the EPC type will either be a maximum or a 95 UCL of a mean. If the program couldn't calculate an EPC, you'll see an NA appear in both the EPC value and the EPC type fields. For bromobenzene in the first row, the program wasn't able to calculate an EPC because all the bromobenzene records were non-detects, which you can confirm in the number of detected observations field on the right side of the table. If you click the green plus sign next to each row, the row will expand and you'll see some additional information. I'll click the plus sign to expand the building 1 SBI groundwater 1,2-dichloroethane row so you can see what all is there. In the expanded row, you can see the chemical cast number, the total number of observations or records in the data set, and the maximum detected value in the data set if it had any detections. Also, the expanded information provides notes that identify how the EPC was calculated. In this case, the program uses the maximum detected value because the data set contained less than 8 records. I'll minimize this row by clicking the green minus sign and expand one where the program calculated a 95 UCL. For this EPC, the data set contained between 8 and 19 records, so the program tested out various data models and determined that a normal distribution best fit the imported data. As a result, the program used the 95 UCL of the normal distribution that best fit the data as the data set's EPC. I'll click the green minus sign again to minimize the row. One other neat feature on this screen is the search bar at the top of the table. The search bar lets you filter the results in the table down to only the results that contain whatever text you type in the search bar. Let's suppose, for example, that I want to find all the EPCs for toluene. I could go in the search bar and type in toluene, and the program will filter the results to show only the 3 EPCs associated with toluene. The search feature looks for the text you type in across all the fields in the table, so you don't have to specify which columns you want to use when you type in a search term. I'll clear out toluene from the search bar to bring back results for the whole table. At the bottom right of the table, you'll find some navigation buttons for viewing results not currently shown on the screen. I'll click the 2 button to bring up the next set of 10 EPC results for this data set. For this next set of 10 EPCs, you'll notice that the latter half of them have a purple circle with an eye in it in the EPC quality control flags column. An EPC quality control flag means that there was something about the EPC calculation that you'll need to take a closer look at. To figure out why the result has a flag, you can click on the purple circle to bring up a message box with information about the flag. I'll click the icon associated with the Building 3 SBI still gas carbon disulfide data set as an example. As you can read in the message, in this example, the 95 UCL was more than 3 times the average value of the input data. The program still returned the 95 UCL as valid EPC, but it recommends that you go back and verify the 95 UCL and look at section 3.7 of the discrete sampling guidance for further information. Section 3.7 of the guidance provides more info about the quality control flags you might receive, and it provides information about how to address them. Also, although it's not mentioned in the message, Section 3.8 of the guidance also provides useful information for addressing issues with your data that might lead to these flags. Topics discussed in Section 3.8 include approaches for highly skewed or highly variable data, approaches for evaluating data that best fit other types of distributions, and approaches for evaluating weighted data. So if you receive one of these flags, check that section as well for ideas on potential issues that might be present in your data set. In general, though, EPCs that have a quality control flag are still valid and can be used in your health assessments, but you should review the data associated with them to make sure that there weren't any errors in data entry or any other issues that might have led to the quality control flag. I'll click the OK button to close the message box. There's one more thing I want to show you in the results summary table, which is associated with the last 2 records in the data set. To bring those on screen, I'll click the 3 in the navigation buttons at the bottom right of the screen. You can see here that the 2 results for building 6 in this data set both had NAs returned for their EPCs. These 2 rows, the program returned an EPC of NA because there was an R warning or error that occurred during the EPC calculation. In the R warnings and error flags column, you can see that the Building 6 SVI groundwater benzene row has a yellow circle with an exclamation point in it, and the Building 6 SVI soil gas ethyl benzene row has a red triangle with an exclamation point in it. The yellow circle indicates that R issued a warning message when it was trying to calculate the EPC, and the red triangle indicates that there was an error in the EPC calculation. I'll click on the yellow circle to bring up the warning message for the Building 6 benzene data. The top part of the message indicates that the EPC calculation could not be completed due to a warning thrown by R, and the bottom part outputs the specific warning message that R produced. In the bottom part, you can see that something caused an internal function within the EPC code to return either NA or NaN, so the program threw the warning. In this case, the warning occurred in a call to a maximum likelihood estimation function when the program was trying to fit a normal distribution to this data set. So apparently the code couldn't identify normal distribution parameters this time around. I won't show you here, but the input data for this result had a few non-detects with censoring limits that were several orders of magnitude apart. And then it also had a bunch of detections at concentrations well above those censoring limits. So the normal distribution wouldn't have been a good fit. I'll click the OK button to close the box. Clicking on the red triangle brings up the error message for the Building 6 ethyl benzene data. The error message box shows similar information to the warning message box. The top part of the message indicates that there was an error, and the bottom part gives the specific error message produced by R. For this EPC, it looks like the program passed a negative value to a function that required all positive values, which I know occurred in this case because I put a negative value in the input data set for these EPCs, so it would throw this error. In general, if you receive an R warning or error flag, you should review your data import template to make sure that there aren't any errors or issues that might have led to the message from R. If you can't figure out what's causing the warning or error after reviewing your data, you can contact the ATSDR technical team at fast@cdc.gov for assistance. As always, please include ATSDR EPC tool in the subject line of the email so that the FAST team knows that it's a question related to the EPC tool. Once you've finished looking at the error message, you can click the OK box to close it. Beneath the results summary table, you'll see two blue buttons that you can use to download results. The Download Fast Import Data button exports the EPCs you calculated into an Excel file that can be imported into FAST for further analysis. The button will create one Excel file for each exposure unit in your data set. If you have just one exposure unit, it will create just one Excel file. If you have more than one, it will create a zip file that contains a separate Excel file for each exposure unit. The Download All Statistics button creates a single Excel file that has all the statistics shown in this table for each calculated EPC and includes some additional statistics that we'll see on the next screen. I won't click on either of these now because they can take a little bit of time to run, but we'll come back to exporting results for analysis within FAST in a minute. Right now, I'm going to click on the 1 and the navigation buttons to go back to the first set of 10 results for this data set. At this point, the only feature on this screen that we haven't talked about yet are the green details buttons in the results details column. Clicking on the details button in any row will take you to the results details screen, which contains additional statistics and supporting information for each calculated EPC. Clicking the details button in a particular row causes the screen to load with statistics for the EPC in the row you clicked on. I'll click on the details button associated with the Building 1 air benzene data as an example. So the results details screen loaded with the information for the Building 1 benzene air data selected. If we wanted to, we could select a different EPC, contaminant, or medium using the drop downs at the top of the menu. If you click on the exposure unit drop down, you'll see the 6 exposure units for the buildings in this data set. Similarly, if I click out of that dropdown and click the contaminant dropdown, I'll see the contaminants with the results for Building 1, which is the currently selected exposure unit. Picking a new exposure unit resets the data in the contaminant and medium dropdowns to reflect only the values associated with that exposure unit in the imported data. And picking a new contaminant resets the data in the medium dropdown in a similar way. For now, though, I'll leave everything as is so we can go look at the results. The results details page is divided up into two columns. The left column contains statistics about the selected data set and the calculated EPC, and the right column contains two figures that summarize the imported data. Starting from the left, the main results table summarizes information for the contaminant that was shown on the results summary screen. It includes the number of observations, the number of detections, the EPC value in units, and the EPC type. The data set had any QC flags, warnings, or errors, the pop-up icon for those would show up in the appropriate row in this table. If you click on the little message icon in the notes symbol, it brings up the same information that was in the notes field on the results summary page. For this EPC, it says that the data set contained between 8 and 19 records, and that a gamma distribution best fit the imported data, so the EPC was calculated assuming a gamma distribution. I'll click the OK button to close out of it. The next table on the left is the additional summary statistics table. In this table, you'll find statistics for the detect and non-detect observations in your data set, and additional summary statistics that show the arithmetic mean, the standard deviation, the median, and the interquartile range of your data. For the mean and median, the numbers in parentheses after the first value report the 90% confidence interval for each statistic. For the interquartile range, the number in parentheses is the absolute value of the difference between the first and third quartiles of the imported data. Moving on down, the next table is the data model statistics table. This table will only appear for data sets with 8 to 19 observations, since the program only tries to fit a data model to data sets with between 8 and 19 records. The data model statistics table first identifies the data model that best fit the imported data set, which in this case was a gamma distribution. It then identifies properties of the best fitting distribution, including the mean, median, standard deviation, and interquartile range. The last three entries in the table are the goodness of fit test statistics for the normal, log normal, and gamma distributions tested by the program. The program will generally pick the distribution with the highest goodness of fit statistic, but in some special cases it won't. Instances where it picks a different distribution will be captured in a QC flag in the main results table. At the top right of the screen, we have a box plot summarizing the imported data. Before generating the box plot, the program imputes any non-detect observations in the imported data using regression on order statistics. Beginning from the top of the figure, the horizontal lines represent the upper fence or maximum value, the third quartile, the median, the first quartile, and the lower fence or maximum value of the imported data. Circles on the figure represent outliers, and you can hover your mouse over them to see the numeric value for the outlier. In this data set, there was one outlier with a concentration of 0.43 parts per billion. Hovering your mouse over the box plot shows the values and definitions for each line in the figure. The only line that won't be defined by hovering your mouse over the figure is the black dashed line towards the bottom of the image. The black dashed line represents the maximum censoring limit of any non-detects in your data set, which in this case was 0.05 parts per billion. The next figure on the right side of the screen shows a histogram of the imported contaminant data with the density curve of the data overlaid on top of it. Similar to the box plot, the program imputes any non-detect observations in the imported data to detected values using regression on order statistics before generating the histogram and density curve. The y-axis for the histogram is on the left side of the figure. The y-axis for the density curve is on the figure's right side. At the bottom of the results details page, you'll find QQ plots of the imported contaminant data based on normal, log normal, and gamma distributions. The QQ plots provide a visual indication of the goodness of fit of each distribution to the imported data. The vertical axis of each QQ plot shows quantiles of the imported data, and the horizontal axis shows quantiles of the assumed distribution. The distribution of the imported data is similar to the assumed distribution. The points in the QQ plot will approximately lie on the diagonal line shown in the figure. Similar to the data model statistics table, these figures appear only for data sets with 8 to 19 records. Other tables and figures on the results details page may also be absent depending on the properties of the imported data set. For example, we scroll back up and select the building 1 groundwater bromobenzene data that we looked at earlier. You'll see that all the tables and figures disappear except for the main results table. If you remember, this data set didn't include any detected values and was all non-detect, so a lot of the information provided in the other tables and figures on this page wouldn't apply to this data set. The EPC tool user's guide has more information on which tables and figures will appear for data sets with different properties. As I mentioned earlier, you can access a copy of the user's guide and other documents on the resources screen of the program, which I'll go ahead and show you by clicking on the resources tab at the top of the screen. The EPC tool user's guide is located at the top left of the resources screen and is the first item available for download. Other resources on the screen include a downloadable version of the ATSDR EPC-R package, which you can use to run the EPC tool directly on your local computer, and 2 Excel files. The first one, the ATSDR EPC tool example data file, has a pre-formatted data set that you can use as a reference to see how data input into the program's data import template should be formatted. The second Excel file, the FAST contaminants and units file, has a list of contaminant names and CAST numbers available for analysis in FAST, and it gives a list of units that FAST recognizes. The 5 PDFs in the bottom 2 rows of the resources page are all ATSDR guidance documents that we discussed previously. Starting from the left, the first one is the discrete sampling guidance, and the next one is the guidance for identifying exposure units. The next 2 documents are the PAH and dioxin guidance documents, and the final one in the bottom left is ATSDR's EPC guidance for non-discrete sampling. You can take a look at all of these for reference once you have access to the program. So earlier I mentioned that the EPC tool can export results for import into FAST for additional analysis. I'd like to go ahead and show you exactly how that process works. So let's go back to the results summary screen so I can show you the steps involved. To export data from the program, I need to click on the Download Fast Import Data button. Remember that I told you earlier that for data sets with more than 1 exposure unit, the program will generate a zip file containing separate Excel files for each exposure unit. For this data set, we have 6 exposure units, so the program will create a zip file containing 6 Excel files. Clicking on the Download Fast Import Data button brings up a save window asking where I want to save the file. I'll save it in a folder I created on my desktop earlier, navigate to the folder so we can extract its contents for import into FAST. To unzip the folder, you'll need to select the zip file and right-click it. Depending on how your computer is set up, you may have different options in your context menu from the ones I'm showing here. There should be something in the menu though that lets you unzip zipped folders and extract their contents. For me, I can use the 3 extract options in the menu to unzip the folder. I'll click the extract to fast import option to unzip the folder into a subfolder in the same location. You can see that the new fast import folder contains 6 Excel files, each labeled with the name of one of the exposure units from our data set. We'll use these as the import files into FAST, which I'll bring up now. When you're working on a site, I went ahead and had opened FAST here, but when you're working on a site, you can access FAST through the same SAMS portal that we looked at earlier. When you're evaluating site data for a health assessment, you have 2 options for incorporating the EPC tool into your workflow. The first option is to screen your data ahead of time using FAST before using the EPC tool. Once you've screened your data, you can then fill in the EPC tool data import template with records for only the contaminants that's screened in, and then calculate EPCs for just those contaminants. Once you've calculated the EPCs, you can export them out of the EPC tool and import them into FAST to calculate hazard quotients and cancer risks. So that's option 1. The second option is to start with the EPC tool by calculating EPCs for all of your data at once without doing any initial screening. Once you've run the data through the EPC tool, you can then import them into FAST for both screening and further analysis. This method may take a little longer since you need to load all of your data into the EPC Tools data import template, but it has the advantage of only requiring you to use each program once. For both of these options, the steps for exporting data from the EPC tool and importing them into FAST are the same. The only difference is what you do with the data after you've imported them. To import data into FAST, we'll first need to specify the site that we're evaluating. To do so, I'll click on the Site Information and Data button in the upper left corner of the screen and select the Site Information option in the pop-up that appears. When you first arrive on the site information screen, all of the site fields will be blank. If you haven't entered a site before, click the Pick a Site drop-down button and select the Add New Site option to enter information for a new site. To save some time though, I went ahead and created a site called EPC Tool Demo Site to use for this demonstration. So I'll skip this step and press the Site Data button to move on to the Site Data screen. On the site data screen, you'll need to pick the site that you're evaluating from the Pick a Site drop-down menu. I'll click the drop-down menu and select the EPC Tool Demo Site. Next, I'll click the Choose File button and find the exposure unit file I want to import. FAST only allows for analysis of one exposure unit at a time, so I'll open the file for the Building 1 exposure unit that I exported from the EPC tool. You'll see the file name of the file you selected appear in a box where the Choose File button used to be. I'll click the Import button to load the data set into FAST. Upon a successful import, you'll see the max concentrations and EPCs exported from the EPC tool appear at the bottom of the screen. In this case, we imported data for the 2 air PCs and 8 groundwater EPCs for Building 1. The data imported include the contaminant names and task numbers, the media, the maximum concentrations in their units, the EPCs in their units, and the EPC type. For this data set, the groundwater EPC for bromobenzene has a red box around the max concentration in EPC fields and a big red circle with an exclamation point in it next to the contaminant name. Since the bromobenzene groundwater data for Building 1 were all non-detects, it didn't have a max value or EPC, and there weren't any results to import into FAST for screening. Any records for which the EPC tool wasn't able to calculate an EPC will import into FAST in the same way that bromobenzene did in this example. In the Excel files exported from the EPC tool, you'll see a column labeled Use Results in FAST that will have a no in it for any results where the EPC was NA. I won't show you that now for the sake of time, but if you don't want these results to appear in FAST when you're importing data, you can remove them from your data set ahead of time by deleting all the entries with a no in the Use Results in FAST field. You'll still be able to run screening and exposure calculations on the other contaminants if you leave them in those, so it's up to you if you want to remove them. If you haven't screened your data yet, you can press the Run CV Screen buttons to screen all the records with a blue check for CV exceedances. If you've already screened your data and just imported EPC results for contaminants that's screened in, you can click the Run Exposure Calculator button to calculate hazard quotients and cancer risks. In this example, the Run Exposure Calculator button is active for the air records because FAST has a module for evaluating air results, but the SPI Groundwater Run Exposure Calculator button is grayed out because FAST doesn't include a module for evaluating soil vapor intrusion from groundwater. We won't get into the details of conducting evaluations in FAST today, but you can find more information on using FAST on the FAST resources page and on ATSDR's FAGM website. Now I'm going to minimize FAST to reopen the EPC tool back to the data import page, since there's one more thing I'd like to show you before we wrap up. So I mentioned during the intro presentation that the EPC tool includes some additional calculation steps for both PAHs and dioxins. For PAHs, the program calculates BAP equivalent concentrations, which represent the overall carcinogenicity of a mixture of PAHs. And for dioxins, the program calculates dioxin TEQs, which represent the overall toxicity of a mixture of dioxin congeners. Remember that BAP equivalents apply only for cancer evaluations, whereas dioxin TEQs apply to both cancer and non-cancer evaluations. Before we close, I want to show you what the output from the program looks like for data sets with PAHs and dioxins. I'll load in a sample data set that has concentration data for both types of compounds to get us started. In the file that loaded, there were 48 records from 2 exposure units. To make the examples a bit simpler, I used one exposure unit for all the PAH data and another for all the dioxin data. As before, the program will calculate an EPC for each unique combination of exposure unit, contaminant, and medium in the data set. For PAHs and dioxins, the program will calculate separate EPCs for each PAH or dioxin congener in the data set, just like for other chemicals. And it will also calculate a BAP equivalent or a dioxin TEQ for each combination of exposure unit and medium that has data for PAH or dioxin congeners. Any BAP equivalents or dioxin TEQs calculated by the program won't be reflected in the number of EPCs to be calculated field on this screen. So keep that in mind when you're reviewing the numbers shown here against whatever data you may have imported. I'll click the Calculate EPC button to generate EPCs for the imported data. When you're running the program on your own, you may find that calculations for data sets with PAHs and dioxins take a little bit longer than those for comparably sized data sets without those compounds, since the program has to perform some extra steps for PAHs and dioxins. In this case, though, everything finished running pretty quickly. You can see here in the results summary table that the Area 1 exposure unit had all of the imported PAH data. The imported data set included 7 PAH congeners, which you can see listed here, along with the Area 1 BAP equivalent result beneath them. The imported data had records from only 2 samples for each of the PAH congeners, so the EPC for each congener ended up being a maximum detected value because there weren't enough data points to calculate a 95 UCL for any of them. Beneath the 7 congener EPCs, you'll find the BAP equivalent row. In this case, there's only one BAP equivalent row because all the PAH records in the imported data set had the same medium and exposure unit, so there was only one unique combination of those 2 fields of PAH data. I'll expand the row so you can see the rest of the information that the program provides for the BAP equivalent. The number in the EPC value field is the BAP equivalent calculated using the EPC for each PAH congener. And the maximum detected value is the maximum BAP equivalent for the 2 samples. Because the EPC isn't a maximum value or 95 UCL, the program assigns it an EPC type of other. The steps to calculate these BAP equivalents are pretty complicated, so definitely refer to the PAH guidance document for more information on how these are calculated if you're interested. Also, you can look at the recording of the PAH training webinar that occurred last week for more information once it gets posted to FAGM. The other fields in this row, the number of detected observations and number of observation fields both have NA listed, and the CAS number for this record is a null value instead of a regular CAS number. The null CAS number that you see here for BAP equivalents is the same as the one used for them in FAST. So if you export this result from the EPC tool to FAST, FAST will recognize the result as a BAP equivalent and will process it correctly. At the bottom of the row is a note about what the maximum detected value and EPC represent and how they should be used. If you look on the right side of the row, you'll see that the green details button that's normally present for each EPC result row is missing from this one. The results details page isn't set up to show the details of the BAP equivalent calculations, which all occur on the program backend. The only numbers that the program reports for BAP equivalents are the ones you see here. You'll see similar results provided for the dioxin TEQs. I'll minimize this row and select 50, and the show entries drop down at the top of the screen so we can see all the dioxin congener rows together. To keep things simple, I set up the imported data so that all the records that have Area 2 listed as the exposure unit are dioxin congeners. The imported data set includes records for 17 dioxin congeners. Like the PAH data set, these results came from only 2 samples, so the EPC tool assigned the maximum detected value as the EPC for each congener with detections, since there weren't enough data points to calculate a 95 UCL for any of them. All the congeners you see with NA listed as the EPC value didn't have any detections in the imported data, so the program wasn't able to assign an EPC. The dioxin TEQ concentration is reported in the row that has 2378 TCDD-TEQ written out as the contaminant. I'll expand this row so you can see everything that's reported for it. Similar to the BAP equivalents, the dioxin TEQs use a null CAS number that matches with the null CAS number shown in FAST for dioxin TEQs. Also similar to the BAP equivalents, dioxin TEQs don't have the option for Viewing additional information on the results details page, when the program doesn't display results for any of the intermediate calculations that lead to the output values you see here. Instead, the program reports only a final maximum and EPC dioxin TEQ value for each unique combination of exposure unit and medium that contains contaminant records for dioxins or dioxin-like compounds. Unlike for BAP equivalents, however, for dioxin TEQs, the program reports the number of detected observations, the number of observations, and the EPC type is either a maximum or a 95 UCL. It's able to report these values because the dioxin TEQ EPCs are calculated using the same EPC algorithm that the program applies for other contaminants. For the dioxin TEQs, the only difference is that the program is using aggregate sample TEQs as the inputs into the EPC algorithm rather than individual contaminant results. Mentioned earlier that the test data set included results from 2 samples with dioxin and dioxin-like compound records. The 2 shown in the number of observations field and in the number of detected observations fields in this case represents these 2 samples rather than the number of congener records or detected congener records in the imported data set. If you're analyzing these data, you could press the download fast import data button at the bottom of the screen to create files for import into FAST. For this data set, pressing the button would generate a zip file with 2 Excel files, one for the area 1 exposure unit with PAH data and another for the area 2 exposure unit with dioxin data. For the sake of time though, because we're coming up on the end of the presentation, I want to go ahead and stop here with the formal presentation. And at this point, turn it back over to see if there are any questions that have come in or if anyone watching has anything that they'd like to ask.
Yes. Thank you, Will. We have a couple comments. One related to the evaluation of RAD contaminants with the EPC tool. So I'll start, and then maybe Will, you can add to it. But basically, all of the guidance that we have developed that went into the development of the tool were specifically related for chemical contaminants. But I believe that we incorporated adding RAD contaminants to the data import template just because there is some screening that is done in FAST for some limited number of RAD contaminants, but we don't want to give the impression that we would calculate EPCs or doses through this EPC tool. Do you want to add anything to that?
Yeah, so I guess I remember we brought that point up when we were talking about the imported template.
Yeah.
Essentially, the way this is set up is the units here will accept whatever units you enter into them. So particularly for radiological data, you could put those types of units in here. Similar if you just had mass information and set up concentrations, you could put similar units in here. The program will calculate those using the EPC guidance algorithm.
Yeah, but
right.
But it's important to note, and we'll get together as a group to make it sure that it's clear that when you're calculating an EPC for radiological contaminants, it's a different process, and that the health assessor should contact one of the SMEs for radiological contaminants to evaluate and calculate EPCs and doses and so forth. So we'll make that clear in the future. So. Yeah, so a person Paul Sharp, who was one of the radiological SMEs, made a little note in the chat box that the radiological contaminant should only be for uranium as a chemical. So Paul will make that clear. So we did have another comment, Will. Should the BAP and dioxin values come from a Kaplan-Meier database instead of what has been discussed?
Rather than using what comes through the program.
Mm-hmm.
So the program is set up, the calculations being conducted there follow the steps in the ATSDR guidance document specifically for pHs and dioxins.
Right, and for dioxins, we do use the Kaplan-Meier because those particular data allow for the use of the Kaplan-Meier, doesn't violate some of the assumptions of the model. Whereas we explained last week that because of high detection limits and other factors, we could not use the Kaplan-Meier for BAP. So we chose a different route, which is already programmed into the EPC calculator. Is that right?
Correct. Yeah, the calculator reflects the current guidance, and so it should match with what was presented in the training last week.
Yes. Then we have another question from David. How many significant figures for the EPC?
I think it will show, let me see if the fast results are still up. So the program returns as many significant figures as the EPC is calculated to. So it's double precision. So it'll give you 16 digits associated with the program. The health assessor then has to decide how many of those are significant. The program itself doesn't make that decision. It just returns the mathematical output from whatever the program runs.
Okay. And we have some other guidance and rules of thumb to how many significant figures we would present in our documents. And FAST has some rules along those lines too.
Yep. I think within what's displayed on screen, it shows no more than 4 digits because we didn't want to set it up to show all 16 every time. But if you export the data, it includes as many digits as the program calculates.
Okay, great. Yes, we're past time right now. And so we'll get together again on the RAD issue, and I don't see any other comments. We did get a comment about the official discussion of significant figures, which we'll take a look at. Thanks, Paul. But for the sake of time and running over, we appreciate everyone attending today. I would also point out that the last of the series of webinars, the number 7, will be this time next week, and it will cover the FAST shower model module of how, and several weeks ago, Will presented on the new shower model, but this actually then takes that and shows how now you can incorporate the output from the shower model and how it gets integrated into FAST. So I encourage you, if you have time, to attend that next week. But also remember too that if you cannot make it, all of these, as I mentioned, are being recorded and will be posted on the CDC YouTube playlist. And I put that link in the chat earlier in the webinar. So thanks again for your time today. Thanks for all the comments. And thanks, Will, Rebecca, for participating today and all your help. Hope everyone has a good rest of the day. Thank you.